Welcome to We're on ECMO, a video series where I ask ECMO questions to ECMO experts and share their answers with the ECMO community. Today, I'm joined by the team of Inventors for the RediStik Pediatric ECMO Cannulation Trainer, pediatric nurse practitioner Michael Pickett, Dr. Mark Mazziotti, and perfusionist and ECMO simulation expert Cole Burgman. Thank you guys for joining me today. And my question today is a two-parter. First, can you share with me the greatest risk and complication during a cannulation of a pediatric ECMO patient? And second, what is the best way to avert the risk, and what tips would you share with physicians that are learning and developing this skill of pediatric ECMO cannulation?
Yeah, Mark Mazziotti, I'll answer that question. I think it's a multi-factor question, actually. There's a lot of things that can go wrong in a cannulation. So, from not identifying the right landmarks or cutting down on the right area to tearing the vessels or not handling them properly as you cannulate. Certainly positioning of the cannulas can be an issue, and both on the artery and the vein, and also how are you doing the procedure? Are you doing a cut down? Are you doing a percutaneous approach? So things can go wrong anywhere along the way. Certainly, even with the cannulas in place, you have to make sure that before you set up with the circuit that there's no air in the circuit. You need to have a methodology to make sure that you're not going to be providing an air embolus to the patient. You also need to make sure that your cannulas are secure and that they're not going to be moving, because a lot of times the positioning is exceedingly important. And or if it comes out, let's say you have a very small baby and it comes out of the vessel, that can be an absolute disaster. So I know I said a lot of things there, but they're all important. And I think the best way to avoid these pitfalls is to really have a lot of experience and that you've done the procedure many times. Unfortunately, sometimes with surgery, you know what can happen because you've seen it. And you want to, along the way, prevent any of those things one step at a time. Even just putting in a central line on a patient. I know each and every step that can cause a problem, and we try to avoid it. And if you're working with trainees, you have to be even more observant, and because they're not exactly your hands doing the procedures. So although you are definitely directing and giving the utmost assistance during during the procedure, it's something that you really need to have all those complications or problems that could occur in the forefront of your mind.
Awesome, absolutely. Yeah, anybody else have anything else they would add to that?
Yeah, I'm Cole Burgman, ECMO supervisor here at Texas Children's, and the complications that I see the most, as far as from the specialist, primer, perfusionist, whoever may be behind the pump, are the communication. Not being able to communicate appropriately with either the surgeon, the OR team, can lead to big mistakes. Putting the wrong cannula in the wrong vein, throwing away a piece of the cannula that's highly needed, which may delay care, attaching the lines inappropriately, the red to blue and blue to red, all can have detrimental outcomes to this procedure. And so I think, like Dr. Mazziotti said, practice, practice, practice. And the time to practice isn't with a patient. That's the worst time to practice. So if you can work together as a team outside, and I know it's time consuming and everybody's busy, but just one or two practices outside may help prevent some of these small errors that could be detrimental to this whole procedure. And we have, probably like any other hospital, high turnover. You'll show up in the middle of the night and there's a OR tech or a nurse or even a fellow that you've never seen before. And so you're trying to teach during a procedure, right? And so as much practice as an entire team can get together can make up for a new face that appears at the most inconvenient time.
Yeah, I think that's excellent. That's an excellent answer. Did you have anything else that you would add, Michael?
No, I don't do the procedure. I'm the inventor, so I'll rely on these guys.
Yeah, absolutely. Well, I think this idea of helping develop this kind of muscle memory through the simulation, as well as just that mental recall and the ability to communicate, these are excellent opportunities that I know you help with by developing awesome trainers like that. While I have the three of you here, I had one final question I wanted to ask, and that was, do you have a couple of things that you could share to encourage the global ECMO community? What would you say that they should be doing, thinking about, dreaming of? And I'll let you guys take it from there.
I'll start off.
Okay.
Yeah, I'll go first. It's every center that I've visited and people I've talked to, it's a little different, right? So find what your hospital needs. Find the needs of the hospital that you're working at or moving to, and try to meet those needs. The community as a whole will grow and we learn from each other, but there are the fine details within each hospital will help that hospital get better, especially now that ECMO isn't a 3, 4, 5 day run anymore. It's 3, 4, 5 month run. And so find the need and find the motivation with the team members to meet that need.
Absolutely. What else you got, guys?
Well, I would say with regard to physician, nursing, perfusionist, hospital goals, that we want the best outcomes for our patients. And we need to continually train ourselves on newer technologies, on, think medicine changes very rapidly, and we need to be learning every day. And one of the ways that we can learn and provide better outcomes for our patients is to be prepared, to communicate well, and to use simulation to do that. And I think the trainer that we have has certainly been used by even first and second year residents. It's something that, they're not going to be putting people on ECMO for maybe 5 to 10 more years, but it's nice to get young people in there to see what we're talking about, to learn from the get-go, to keep these things in the back of their minds. Certainly they won't be, they might be assisting, I think watching is important, but the person that's actually doing the procedure needs to be comfortable. And we have to do these cannulations rapidly. And I think that if we use simulation and good communication, we can give our patients the best outcomes. So we've really, I think, initiated that at our hospital, and we hope that it can be used, all across the world.
Yeah, I mean, our hope is that, we created this simulation tool to help with high risk, low frequency procedure, and to, just in the end, we have patient better outcomes. And again, it's a great opportunity to improve communication and skill set for those involved, and we actually, the videos, we have general surgery video, teaching video, and a congenital heart version as well. And those are open, those are free for people to use through our website. Actually, we our ICU nurses, they will watch those videos to just get a better understanding of what's going on at the bedside. So some of the educators use that, and so those are something that anybody can look at now and gain some insight. But really, ultimately, we just wanted to do some great things and help other people globally, and so hopefully we achieve those goals.
Yeah, well, absolutely. Thank you guys for sharing your answers. Thank you for what you've created. I know I look forward to hearing about how those outcomes are better because of the things that you've created and the education that people are able to receive because of it, the communication they learn, and that ongoing learning that you've said is so important. It's definitely exciting to see those things happening. We want to be a part of it at ECMO Advantage, and it's exciting to see other people doing that out in the ECMO community as well. So thanks again for joining us, and I hope that other people will take a look at what you've got in those videos out there and be able to implement those for those better outcomes. Thank you.